quick intro and tease. So I'll do an intro and a tease first, and then we'll bring Ellen. The 13th Annual Health Initiative for Men. Stay tuned for more after this.
If you drive buzzed, it could cost you around $10,000. You'll face major legal fees, major fines, and steep insurance penalties. You could lose everything. Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving.
Welcome to Community Watch. I'm Greg Shropshire, and today we'll be talking about the Health Initiative for Men, the 13th Annual HIM, hosted by the 100 Black Men of Rome, Northwest Georgia Incorporated. So it's going to be a great subject today. It's a lot of changes with prostate screening. So we'll be talking about the new guidelines that the 100 and Harbin Clinic will be employing this year. So it's going to be a lot of new information, but it's going to be about a great event. So stay tuned for more right after this.
$7,000 high school students drop out every school day. That's a line of desks more than 4 miles long. We can keep students in school. Visit boostup.org and take the first step.
Welcome back to Community Watch. I'm Greg Shropshire. And today we're joined by Mr. Larry Morrow, the chairman of the Health Initiative for Men from the 100, and Dr. Raymond McCoy, a local physician. Gentlemen, welcome to the show.
Good to be here.
Now, I know this is the 13th year for the Health Initiative for Men, Mr. Morrow. And over the years, this health screening, health fair has really grown. What do you contribute that to? I mean, it's been 13 years and it continually to grow, and it seems like has even taken in more screenings over the years.
Well, Greg, I think one of the reasons is that a lot of men now are more concerned about their health. One of the things we've emphasized over the years is that men should be aware of what's going on with their bodies. And we've stressed this, and I think it's finally, the point is finally, got to them, and along with the talk with other men, our organization, I think that that's one of the main reasons why it continues to grow, word of mouth.
Dr. McCoy, is this a trend? Are men becoming more health conscious? I know we're probably still lagging behind our female counterpart, but are men being more proactive?
I'd like to say that men would like to be more proactive. I think the limiting factor is becoming cost more and more. It's getting too expensive to go to the doctor, so as they're becoming more aware, they're more reluctant because of cost.
So we have more awareness, but also due to the
increased
expense,
cost. Yes.
Increased cost, we're not necessarily, even though we have more awareness. What's interesting, when I joined the 100 years ago, and we started, when I first learned about him, prostate screening, it just still wasn't something that was big on my radar. The first couple of years is like, it just wasn't big on my radar. But over the years, the number of men in my family, the number of men that I know personally who has been affected with prostate cancer, and and have had surgeries or treatment, you know, it's really has been quite a few. But just to think several years ago, I had no clue. But it's almost like, you know, as my awareness grew, I became more aware of the men in my circle that were affected by prostate screening.
Well, you're also getting older now, so it becomes more of an issue the older you get. So keep that in mind. So.
Yeah.
Well, I actually started
You're
getting
right.
mine. Yeah,
You're right, Greg. You know, I think you joined the 100 over 10 years ago. And you just think 10 years ago you was a young man. Young men don't think about things like prostate cancer and those kinds of things. I don't think I thought that much about it. But since joining the 100, and you know, you've been made aware, and you realize now how important it is, and that you've made it a priority, because I've heard you say, and that was one of the priorities that you're going to have in the future, making sure your health is, you know, is you check your health out, and you're going to make sure everything's going okay, because as we get older, you know, our body begin to talk to us. And
a lot more.
A lot more,
every
yeah.
day.
I know there's a lot of things that I didn't think that I'd go through, that I've been through, you know. I just didn't think it was going to happen, but you know, I'm a prostate cancer survivor, and you know, I was detected 3 years ago, and I can say that yeah, I'm certainly glad that I'm aware. I'm more aware of you know, of its effect and how it can affect you know, a man as you get older. But then too, I'm also aware of the fact that there's means of, and there's ways to be treated.
Well, you know, that bring up a good segue, Brother Morrow. We have new guidelines now. Before, basically, if you was a man over 40, get screened. Well, in the African American community, especially over 40. I think it was like 55 if you were white. But I know now a lot of physicians have changed. And I know this year at HIM, we will be employing some new guidelines. Can you give us a little information about, you know, is there new research, or what is it that has kind of changed the way we're doing the screenings now?
Well, Greg, if you don't mind, I'd like to refer that question to Dr. McCoy, his physician.
Well, it's a very good question. I bring up cost again. Cost underlies everything. And we're in a state of cost containment, particularly with health, since it's taken most of our GNP, as you know. And so we're into what we call evidence-based medicine. So they basically use statistical strategies to figure out the most beneficial population. And it appears that a lot of the younger guys who've been screened have really not given any extra benefit to the to treatment. And the higher risk populations are the ones that we really want to target. And that still remains people in the, or men in the African American community. 40 and sometimes younger than 40. And so the American Urological Association have set the guidelines, and you now have to, well, first of all, we don't jump at treating men over 70. It's just, it hasn't really proven to be very beneficial. In fact, it could be more deleterious or harmful on them to go through unnecessary screening and, you know, psychological effects, and then testing that may cause some morbidity. So it's not necessary. And on the younger population, we don't test anyone under the age of 70 unless they're in the high risk category, meaning a family history or first degree relatives, meaning your brother or your father have had prostate cancer, or African American still remains one of the highest risk factors. So that's what the new studies and data are telling us.
So basically, with the new guidelines and at health fair, men between the ages of 55 to 69 are the men that we're pretty much targeting in the general community. But for African Americans, we're still saying 40.
40, and I'm stressing 40 and younger in some cases, because I have known quite a few guys who've been under 40 who happen to have been African American with prostate cancer. And so if you've had a first degree relative with prostate cancer, you know, now me personally, I would say that even starting after 35 would not be unreasonable, just as we tell women with histories of breast cancer. So But 40 is certainly a good starting point for African American men.
Now, it's interesting that you say, Doc, that due to cost and other factors, of evidence-based medicine, which we have to rely on the data that we have.
Right.
But it makes sense, though. I mean, because becoming more aware of prostate cancer, my uncle who was diagnosed with prostate cancer, I think he was 72. And he died, but at the time, when I was asking him about it, he said, well, I just told the doctor I'm not going to deal with it because he said I'm already 72.
Right.
He was like, what is my life expectancy?
Right.
And at that time, I was like, you probably still should, but being the patriarch of my family as he was, he said, he looked at everything and he looked at the potential side effects, and he was just under the impression that for him, at 72, he had a chance of dying of something else
exactly.
just as much as he did with being diagnosed with prostate cancer. And it was then that I realized just because you're diagnosed with prostate cancer doesn't automatically mean death. It could be benign for years, and that's good that with the evidence-based medicine that it really pushes us to learn more about prostate cancer itself and not just do screenings, but really learn about the disease itself.
Right, that's a good point, because if we all live long enough, we're going to have some degree of prostatic hypertrophy, cancer, or what have you. But I mean, it would take so long before it would take you out. So if the life expectancy is 10 to 15 years, there's no sense in digging. Just enjoy your life. So that's kind of how.
Now, Brother Marlon, let me ask you now, we got the new guidelines, and you're having the health fair is Saturday, August the 16th from 8 a.m. to 12 p.m. at the Floyd County Health Department. Are there any new screenings that are being added this year, or is it pretty much the same? And the reason I say the same is that this is the only health fair that I've been to that is very jovial. It's very just friendly. I mean, it's a lot of just interaction going on between people during and between testing. So is that pretty much the same, I guess, the same format?
Pretty much so, Greg. We have no new screening that I can think of right now. But the thing about this particular health fair is that over the years, a lot of friendships have been gained. There's, like you say, it's kind of joyful, and people are there to be screened, but then too, they're there to talk with each other. We've got some participants, it's been coming for 13 years. We hope to see them for that 13th year, but we've had quite a few. But it's just something that where you've got just a group of men, and they come together and they're all there for the same purpose, and I think they're just glad to see each other, to know that there are other men like them that, kind of want to make sure that health is up to par.
Now, I just noticed now some of the screenings will be vision, diabetes, cholesterol, skin cancer, nodular neck exams, the coarse prostate, stroke and blood pressure, HIV screening, dental exam, foot and wound care, colorectal cancer. And that's one thing I like about this health fair, because even though we know statistics show us that men live longer with wives and significant others in their lives, so we encourage women to come on too, to make sure that your husband or significant other, if he's in that 55 to 69, 40 and up, if he's African American, to come out with him as well, because there are other screenings that women can participate in as well. And two, I just think if we can get the family to start thinking healthy, a lot of times in most of our homes, if we're honest, a lot of times we don't necessarily dictate or decide what we're eating that day. Right. And so if we can kind of change the mindset, I think, of the people that really kind of minister what we're eating, that definitely affects our health. So women, definitely we encourage them to come out, because there's some other screenings. But if you come out, bring a man with you. Bring a man with you. Right. Now, Doc, let me get back to a question concerning the whole medical practice. Now, is this something we will see going forward, evidence-based medicine in all screenings, or pretty much with all illnesses?
Yes, this is actually where medicine is going over the last decade, actually. And given the cost of medical care in this country particularly, you're going to see more emphasis on evidence-based medicine protocols. I do want to address the prostate thing. It's a big health fair. We want everyone to come, just as you said. And I think you answered your first question about, are men proactive going to the doctor? You just said it. If they're married, they are, because the wives usually get them there and they live longer. But at the same time, given these new guidelines, and there are some somewhat stringent changes, we don't want to discourage anyone to come out. We still would like everyone to come out because there are multiple protocols being done as far as screening, and they can still learn from it. But Harbin Clinic will not pay for it if you don't meet these criteria. And the same thing will apply if you go to your family doctor. If they're not the criteria that are set by these guidelines, the insurance companies very well may not pay for it. But that doesn't stop you from paying for it if you still want to get it done. So,
Well, we have going to take a quick break, and but when we come back, we're going to talk a lot more about the 13th Annual Health Initiative for Men and some of the things you can do to be more proactive. So stay tuned. We'll be right back after this.
Traditional light bulbs actually generate 9 times more heat than light. Switch to Energy Star light bulbs, and you'll realize just how much cash you are really burning through. Saving energy saves you money. Learn more at EnergySavers.gov.
Welcome back to Community Watch. As you can see, we're joined in this session of our show, Dr. Hirsch. Doc.
How are you?
I'm fine. And yourself?
Gentlemen, I'm sorry to enter the party halfway through, but I appreciate you.
Oh, no. You're a very health conscious person.
I don't know about that.
I didn't say healthy, I said health conscious.
Yes, I'm aware of what I'm not doing.
Yeah.
Yes.
Because actually for years you've always told me information about different health aspects and different things. And and I know you have a very big interest in the Latino community. I know you do a lot for his mentoring and other things. But one thing I noticed, Mr. Barrow, is that the number of Latino men have increased pretty much every year. And to now I know 44 men, which is 14%. I can remember we would have 2. So to have 44 is significant. And I think that goes a lot to what you and the committee have done for us, making sure the flyers are in Spanish, putting the word out in the different communities. But I guess that has to be something that you and the committee are proud of, that the number of men, Latino men, is steadily increasing.
We certainly are. There's a couple of outreach programs here in Rome that we've been in contact with to ask them to help encourage their participants, our clients, to come to our health initiative. One is over at West Rome Baptist Church, and then over at St. Mary. Both of those churches have a outreach program for the Hispanic community, and we've asked them to get the men that part of their organization to participate with us. And then to Greg, word of mouth. They kind of tell each other, and then it's free, and that also that helps a lot, because you got a lot of men that don't have health care insurance, and anytime something's free and this important, I think we get the participants.
What's interesting when you talk about that, and you say free. It's free, but it costs other people.
Right.
It's free to the public, but it costs other people. And I really would thank Harbin Clinic, American Cancer Society, Florida, Redmond, the Deltas, Lamar del Sur, the Northwest Georgia Cancer Coalition, and the Public Health, and some others. The blood assurance will be there, the HIV testing, we have that every year with Frank and his group. So while it is free for the public, there are a lot of people that work with the 100 to make this happen, and we really are thankful for those and some of our vendors. I don't know about last year, but I know for several years, Frank Tant had told me that they did more HIV screenings on that day than they did any other time of the year. And I know at one point the amount of blood they collected among African Americans on that day was more than they collected any other time of the year. So even though it was a prostate health fair screening, the benefits of the health fair far exceeds just prostate screening.
And, well, that's true. Rick, the thing about the Rome community, it's been said over and over again that this is a unique community, a community that support each other, and we've had great support over the years. I don't think the 100 Black Men itself could fund this by themselves. So you're right, it's free to the public, but there are other expenses that are involved here. And some of the expenses are shared by donations, and we do get quite a few donations for this event. And I just think that the community has just come together, and they have just really worked, especially the Harbin Clinic and Northwest Georgia Cancer Coalition. They have really been the backbone of our financing. And again, it's just it's a project that we certainly, I said we, the 100 Black Men, certainly couldn't take on, by ourselves.
Nor do we want to.
Yes.
I'm curious. I know that this initiative has the reputation of discovering health situations and illnesses that men might not have found any other way. But there's been such a push in recent years for preventative medicine and just wellness in general. And I'm wondering if you were seeing men that are buying into that as a concept of being more careful about their health.
Yeah. In other words, are you asking the same question? Are men becoming more proactive with regards to their health, or?
That and in terms of at this particular event, is there a real push toward education
health.
as well as?
Oh yes, absolutely. Yeah. That's actually a major part of it, is educating the community. We used to have lectures on with regards to hypertension. There used to be a lecturer. In fact, I was one of the lecturers, and while people were going around, we'd have different lecturers in classrooms teaching people how the whole cardiovascular system operates and how prostate cancer develops and all that type of stuff. And maybe we may need to get back to that.
You know what that question tells us, Dr. McCoy, Mr. Morrow. Now we know Doc have insurance. So clearly he don't come to him because he would know that, but clearly, but you are right, and that's one of the things I do like about the health fair, is that it is not just a screening, it's very educational. And I know when I look at my view of the health fair when I first joined it now, I mean, it's so informative from not only from a male perspective, from a family perspective, because you really have the opportunity to learn a lot of and the providers, they seem like they just really enjoy doing what they do that day, the amount of education. I remember I walked in one year, and a good-looking man like myself, I'm confident in what I look like and everything, and I walked by the dermatologist. I think I walked up to the dermatologist table. She said, your face is like 4 different shades of brown. I'm thinking, what are you talking about? She was like, yeah, you got 4 different. So, of course, I went home, and I'm trying to figure out. But I mean, just that kind of information, how as a professional, she could see the different shades in my face that I just never paid attention to. And so, I mean, it's really very informative. And if nothing else, I think people will walk away with that sense that, you can learn a lot about your own health at the health fair.
Yeah. And in defense of Dr. Hershey, there are a number of men who come who have insurance. They just find it too costly to use their insurance. This is an easier route for them.
So basically, I guess if you have insurance, you can come have this test because it's free, and then I guess you can take
if you meet the criteria,
yes. Then you can just take those results back to your
physician, and we typically will send the results to your family physician if you have one anyhow. So.
Right.
Okay. Well, I'm about to send mine to and I got to admit, I've been incorporating into this whole Harbin thing now. I mean, I'm trying to just get all of my screenings and all of my health done by one vein. And so that kind of information, I guess, is the kind of information I need, because for years I never had a primary doctor, so I guess I need to kind of start keeping up with that. Mr. Moore, what about, even though we're changing the guidelines, do you think the numbers, are we expecting the same type of numbers this year?
Greg, I don't think the numbers have changed. I think we've not this year anyway. This is the first year that we've dealt with the new guidelines, and I don't think they'll change this year. Maybe next year.
Actually, they were in place last year. They had just started. They came out in May of last year, but now they're really impacting.
Yeah.
So.
And what we're going to do this year, we're going to give every participant while they're in line waiting, we're going to give them a list of the criteria that need to be met in order to be screened for prostate, and it'll be new to some. This information that we're sharing now, it'll be new to a lot of people. And there's going to be the question as to, well, why? And that's what we'll have to get over to people, that is the reason why we are not screening men over 70. And I think next year maybe it'll change some, but I just don't think, especially with all of the other screening that we're doing, even if they don't get their prostate, screened, they'll still want to do the other screening. Now, I can say this much: normally, the prostate line is the longest line that we generally have. People want to get in and want to get out, and again, we just have to wait and see. But I don't think this year the numbers will change that much.
Yeah, and I'm glad you said that, because when we look at the screening criteria now, the lines will be shorter and they'll look differently. I think the people in the lines will probably be a darker complexion when they meet the criteria. Right. And so I just want to make it clear this is not any egregious attempt to sample only a certain population. We're just following the guidelines for those who are at higher risk.
And for men over 70, we still encourage them to follow up with a local physician to discuss possibility of testing.
And any other man who was in that category outside of the screening criteria. So,
so I'm curious, Doc, with your knowledge of the health, being health conscious, do you see, I don't know, I'll take it all day, but do you see a role as we progress, as men becoming more proactive? I would like to think more proactive. Do you see more students becoming more proactive with their health? Young men.
I don't, other than in terms of maybe exercise, but for the most part, I still see pretty bad eating habits and a lot of lack of concern and for, I guess, lifestyle issues. We had an event this weekend with Brother to Brother. One of the leaders in that group of 8 is vegan, and that is new to me.
Well, I still not convinced that mushroom tastes like a steak. I'm just sorry.
But I mean, the fact that there's 1 out of 8, I guess that is a significant change. But I don't see it happening. I still see that generation as largely a chicken fingers and fries.
Before we take a quick break, Brother Morrow and Dr. McCoy, one thing I can say though, clearly the message is getting there, because when you look at the number of men that were screened and the number of men that get prostate screening compared to the other screenings, clearly the message is out there, prostate, because it's such a huge drop off from the next screening after prostate, that clearly men come with a focus on getting prostate screening. We're going to take another break, and we'll be right back with more information about when and where right after this.
Packers. Viking. Packers. Viking. Viking.
Red state, blue state, vegan.
Carnivore.
We come from different places.
Uptown.
Downtown.
Optimist.
We come to different conclusions.
Half empty.
Half full.
But when we live united, we create real, lasting change in the building blocks of life. The education, income, and health of our communities, our families,
United.
even the person next to us.
Live united.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
Thank you for joining us on Community Watch. We've been talking about the 13th Annual Health Initiative for Men, which is August the 16th, 2014, from 8 a.m. to 12 p.m. at the Floyd County Health Department. If you want to learn more, please you can call Dr. McCoy. You can reach out to the members of the 100. Dr. McCoy is with Healthy U of Georgia at 808 Avenue B, Suite C. And also you can reach out, I guess, to the Harbor Urology Department. They've been very big about that if you got some questions about the guidelines and things of that nature.
Well, you can, but the number that we have on our flyer is for the Northwest Georgia Cancer Coalition.
706.
They've stepped up this year and they are doing some things.
So if you got a question, you can call 706-291-9809.
Right.
We would like to thank you for joining us this week on Community Watch. Please take your health seriously. We'll see you next week, as always. Thank you.
Thank you.